Established in 2000, the African Comprehensive HIV/AIDS Partnerships, Achap, is a country-led public-private development partnership between the government of Botswana, the Bill and Melinda Gates Foundation, MSD, the Merck Company Foundation, dedicated to supporting and enhancing Botswana's national HIV/AIDS response. Achap officially launched the second phase of support to Botswana's HIV/AIDS response over breakfast at the Gaborone International Convention Center on the 30th of August, 2010. Present at the event were the guest of honor, His Excellency the President of the Republic of Botswana, Lieutenant General Ian Khama, the Bill and Melinda Gates representative, and former U.S. Ambassador to Botswana, Ambassador John Lang. Merck Executive Vice President and Chief Medical Officer, Dr. Michael Rosenblatt. Achap President, Ms. Brenda Colatrella, and the Achap Board Chairman, Dr. Luke Mkinisi. Also present were the Minister of Public Administration and Presidential Affairs, Honorable Lesego Mutsumi, Minister of Health, the Honorable Reverend Dr. John Siakhosing, Minister of Finance and Development Planning, Honorable Kenneth Matombo, Minister of Labor and Home Affairs, Honorable Peter Asier, members of the Diplomatic Corps, and other dignitaries.
I would like to thank you for your presence at this occasion in which we launch Phase 2 of the African Comprehensive HIV/AIDS Partnership, Achap.
Achap's Managing Director, Dr. Themba Moeti, gave a brief overview of the Achap Phase 1 achievements.
We have succeeded in establishing the first large-scale ARV treatment program in Africa. Over 7,000 healthcare workers have been trained through a collaboration with the Botswana-Harvard Partnership and the Ministry of Health. And to help support this program, over 1,600 lay personnel in various capacities have also been trained. Over 90% of people in the country who need ARV treatment are receiving it. We had to support a program that reached out not only to major urban centers, but even to rural areas. Mortality as a result of HIV/AIDS has probably been halved, largely as a result of the impact of the National Treatment Program, with over 50,000 lives being saved, making this, I think, a successful program and a model program for many parts of our continent.
Sustaining the achievement of the first phase of Achap, such as treatment and others, will only be possible if we dramatically and in a sustainable way reduce the rate of new infections. The purpose of Achap's second phase is to build on the achievement of the first phase by focusing on scaling up HIV prevention intervention. This includes scaling up access to safe male circumcision among youth aged 15 to 29, design and implementation of innovative HIV prevention strategies targeting young women, also continuing support for the AIDS treatment program MASA, and strengthening the integration of TB and HIV services to achieve a better quality TB service and improve outcome for patients co-infected by TB and AIDS. Your Excellency, distinguished ladies and gentlemen, it's our expectation that throughout this second phase of Achap, in collaboration with the government and other partners, Achap as an organization will identify and establish mechanisms to ensure its own sustainability in order to continue providing effective support to emerging needs in HIV response in Botswana and possibly in the region.
I went to Bufa with my parents and we got tested.
You got tested at Bufa at your age?
Yes.
You're not serious.
And what have you learned from these two projects?
I am 12 years old. Through the Bufa Health Talks, I learned various ways in which young people can protect themselves against HIV infection and teenage pregnancy. Most importantly, I learned abstinence is by choice and not by force.
Impressive. And you, my sister?
Sports has benefited me a lot. I initially went to the Bufamushud Center with the main purpose of enjoying some sports and games as a way of spending my leisure time. I'm glad to share with you today that not only did I enjoy some sports and games, but I participated in several health sessions that were integrated with the sports activities.
We have seen that Bufa and Achap are doing a lot in this country to try and empower the young people to make right decisions together with their responsibilities in mitigating challenges they are facing, especially on issues that affect their sexuality and productive well-being.
As all of us in this room embark on the second phase of Achap, I'm pleased to inform you, Your Excellency, that the Bill and Melinda Gates Foundation is fully committed to working with you through Achap with a commitment of an additional $30 million. Globally, we support strategies to implement model programs for HIV prevention, including male circumcision, to improve and develop safe, effective, and affordable prevention technologies, and to develop an HIV vaccine. While we recognize that significant progress has been made in Botswana's fight against HIV, we are also aware that very great challenges still lie ahead. Over 30% of pregnant women are HIV positive. A quarter of the adult population aged 15 to 49 is HIV infected. And tremendous work still needs to be done to secure the behavior change necessary to greatly reduce HIV transmission among the youth and sexually active adults. In the second phase of HAP's support, one of the priorities will be to help better integrate TB and HIV service delivery in order to greatly reduce the number of people with HIV who are dying of tuberculosis. Your Excellency, Botswana has made a great contribution to the fight against HIV/AIDS through the lessons it has shared with the global community in HIV treatment, in prevention of mother-to-child transmission, in commitment of its own domestic resources for a comprehensive response, and in the demonstration that the routine offer of HIV testing can greatly increase opportunities for access to treatment and prevention services. Together, we will be able to help the people of Botswana lead healthy, productive lives, striving for a future ultimately free of HIV.
When we all joined forces against HIV/AIDS in Botswana in 2000, the country was facing a crisis that threatened its future. Now, 10 years later, through the programs we've created, which deliver life-saving medicines, services, and support, Botswana is now a model for the rest of Africa and beyond. And for this, Your Excellency, you and your government deserve much recognition and praise. Today, nearly 90% of those with HIV/AIDS who are in need of treatment are receiving it, and that's the highest coverage rate in Africa, and it's up from the 5% when we began. So the partnership has prevented thousands of lives from being lost. The number of people dying from HIV/AIDS is half of what it was in 2002. We've dramatically cut HIV transmission from expectant mothers to their babies, and that means thousands of infants were born free of the HIV infection. The additional $30 million commitment that MSD is making today, along with the ongoing donation of our 4 antiretroviral medicines, will advance the partnership's extraordinary mission. We thank you for the opportunity to significantly change the course of HIV/AIDS in this country and to help the people of Botswana be well.
re ratile go hela. Aha. Ahele. Ahele. Are go hano re tsile go dumedisa morai yo tetse tshungu re tlile go dumedisa le kokole le mmogo re tlile go dumedisa batho ba kopanye go tla go tolla selo. Irile gore se batsa mosetsanyana ke ra o ntsha letsholo kana ntse le sebiwa ke mosadi phakela ntse go monatela mosadi. Mosadi a bolela re ka kwano re mo mokgosi o motona mokgosi ga o kana ka sepe. Ra be ra go alosa lenaneo re tsamaya mo lenaneong la bobedi. Re tsamaya mo lenaneong la bobedi ra be re ntse re katela mabita batho re ratile go swa. Batho re ratile go swa. Re ratile go swa. Re ratile go swa we re ratile go swa. Re ratile go hela.
It is indeed a great pleasure for me to address you on this occasion to mark the formal announcement and launch of the second phase of the African Comprehensive HIV/AIDS Partnership for a further 5 years. Between the years 2001 and 2009, the partnership donated an amount of around $106 million to fund various programs and interventions. In addition, MSD has donated ARV medicines with a value in excess of $66 million by December 2009. This has been a huge contribution which has made tremendous difference to our fight against the disease. It is important for it to be recognized that the growth and sustainability of our civil society movements will be a key and long-term success against this epidemic. HIV/AIDS remains the greatest health and development challenge that Botswana has faced over the past 2.5 decades, and indeed will continue to face for several years to come. I'm informed that a core part of Achap's work in your second phase will focus on prevention interventions targeting young people aged between 15 and 29. Prevention is also the top priority of our second national strategic framework for the period 2010 to 2016. So I'm pleased to know that Achap continues to align itself with our national priorities. I would like, first and foremost, to thank once again both MSD and the Bill and Melinda Gates Foundation for having found it fit to commit to a further 5-year period of support to Achap and Botswana's HIV response. A financial commitment of $60 million in these very difficult and uncertain economic times is something for which I personally, my government, and the people of Botswana are most grateful. As I conclude, I wish to take this opportunity to indicate to our partners in this endeavor that our commitment as a country to winning the fight against this epidemic remains very firm. And as a sign of our commitment, 70% of HIV/AIDS expenditure, as shown by the latest national spending assessment, has been from Botswana's own domestic funds. We hope that this commitment on our part will encourage you as partners to continue to support us, knowing that your support builds on our efforts and together we'll make meaningful progress. It is now my honor and pleasure to declare the second phase of Achap's support to Botswana for the period 2010-2014-16 officially launched, and I thank you for your attention.
The World Health Organization and UNAIDS report that more than 5 million people are on treatment in low and middle-income developing countries, indicating that the seeds this partnership has sown have spread far beyond the borders of Botswana. Of course, as we celebrate this singular achievement, we look forward with renewed energy to the challenges that lie ahead, and the second phase of the Achap support will indeed assist us. Those living with the virus and their affected families and loved ones, our women and children, and all vulnerable populations must be at the center of this response. Let us dedicate the second phase of support to serving them better so that one day the fight against this disease will be truly won. I want to thank you very, very much indeed, and thank you, Your Excellency, for gracing this occasion. Have a pleasant day. Thank you. Pula.
After the official breakfast launch, the Achap delegation visited the Bufa Center in Muchudi to witness the impact of their support to implementing partners. The Achap delegation was welcomed by Bufa staff and youth and were taken on a tour of the center's services and activities. This gave the delegation an opportunity to interact with some of the youth. The Botswana Family Welfare Association, BOFA, is a non-governmental organization that was registered in Botswana in 1988. Its purpose is to address issues related to sexual and reproductive health and rights, SRHRs. BOFA is an accredited member organization of the International Planned Parenthood Federation, IPPF. Achap's partnership with BOFA was to support scaling up of HIV counseling and testing, HCT, and youth HIV prevention services. The support period was from 2007 to 2008 and extended to September 2009. At the end of September 2009, 7,439 youth, 57% of them being female, had tested for HIV at BOFA centers. Of this number, 7.1% were HIV positive. Adults aged 30 years and above also accessed HCT services. Of these adults, 3,918 were tested, 9.6% of them being HIV positive. While the emphasis of Phase 1 was on treatment, the emphasis for Phase 2 will be prevention. Phase 2 will include supporting the government to scale up HIV prevention efforts focusing on young people, including support for safe male circumcision as an add-on prevention strategy, as it has been proven to reduce the risk of HIV infection. Continued support of the ARV treatment program, support for TB HIV service integration, and further strengthening knowledge generation and management for program development. Given the overall impact of Achap support to the national HIV/AIDS response, especially the success of the MASA ARV treatment program during Phase 1, there is a lot to be optimistic about as Achap begins yet another journey in its second phase of support.